Now we have a quorum of 8. We will commence the meeting and we'll invite the guests to come in. Today we are mainly to have a public hearing on the operation of a Chinese medicine hospital, and it's at the request of members. You can now go over to the Housing Services panel because they don't have enough quorum. Okay, we have started the meeting. We'll invite the government officials to join us. Welcome. Permanent Secretary, good afternoon. We have deputations who have responded to our notice, and they have come to express their views. If you are all seated, we will invite the deputations to be seated. As in the past, we will invite the deputations to speak, and then we will let the government respond, and then members' questions. We have 13 deputations who have come to express their views on the mode of operation of the Chinese medicine hospital. So you are seated comfortably. Okay, welcome to LegCo to speak on the mode of operation of the Chinese medicine hospital. You have 3 minutes each. You have channels 1, 2, and 0. You can listen to Cantonese, Putonghua. You can listen to the English also, and you are not protected by the Electoral Powers and Privileges Ordinance. We will first invite the deputations to speak, 3 minutes each, and then the government may respond, and then questions from members. The meeting can take us to 4:30. So without further ado, we will invite the first deputation. This is Mr. Lee. Now, right now, the NGOs, the hospitals, the hospital authority, and the universities cooperated in the pilot scheme for integrated Chinese Western medicine, but the effectiveness is not conspicuous. We hope that the service of Chinese medicine will relieve the pressure on outpatient clinics. Now, there are about 75 graduates from the 3 schools of Chinese medicine in Hong Kong, and graduates from the mainland number over 400. This is 5 times the number of local graduates, so there is a surplus of manpower. The practicing requirements should be raised. Now, the CE in the last term announced that there will be a site set aside in Tseung Kwan O for the Chinese medicine hospital. The government will finance the construction, and a consultant is working on a study, and we hope that the government will the hospital authority. Now, since the reunification, Chinese medicine development has been slow, and however, there has been progress in legislative control, etc. And in the year 2000, the government indicated that the Chinese medicine will be practiced in all 18 districts. And there are now 18 teaching and research centers for Chinese medicine. And the Chinese Medicine Development Board was established in 2013. And in 2014, the government launched the pilot integrated Chinese Western medicine collaboration scheme, and clinical service is provided. The government document points out that Chinese medicine practitioners, now it's clear that there is not enough resources devoted to the development of Chinese medicine. Now the hospital authority noted that the avian flu, that there wasn't enough manpower to handle the influenza patients, and Chinese medicine practitioners' helps were sought. Now, in 2003, the government set up the Chinese Medicine Teaching and Research Centers. These are now the so-called government-operated Chinese medicine clinics, but however, this is of little help, and the costs have been increased to the cost to the public. And in teaching and research, there is not enough research and education of Chinese medicine. Now, in the policy address this year, on the Western medicine side, the government will try to implement as quickly as possible the $200 billion 10-year development scheme. But for the Chinese medicine, the promises have been made a decade and a half ago, but yet there is not enough resources for Chinese medicine. Now, Western medicine is provided with adequate training on Western principles, but not on the Chinese side. Now, we have to reorganize the healthcare structure, and we must reposition the status of Chinese medicine. Now, there shouldn't be just trying to squeeze the finances for the Chinese medicine. Now, Chinese medicine is very effective for the illnesses such as influenza, and it shouldn't be just for recuperation or convalescence. Now, Chinese medicine should be integrated into the healthcare framework. Chinese medicine should take the lead with the supplementary help from Western medicine. There should be a platform for exchanges, and there should be a good institutional framework with funding from the government. Now, it's a five-pronged policy, and the establishment of the Chinese Medicine Hospital is good, but there hasn't been enough preparation. Now, in 2017, the CE in the policy address did not mention that the Chinese Medicine Hospital and the teaching and research centers would be formally integrated into the healthcare system. Now, self-financing is not adequate. Now, the Western medicine hospitals get 87% of the subsidies, and Chinese medicine only get 13%. Now, there is no financial assistance to the public for Chinese medicine. Now, the Western clinics, outpatient clinics, are provided with financial assistance of over 80%. However, the cost of Chinese medicine and the wages, salaries of Chinese medicine practitioners are inadequately provided for. Now, the managers of the schemes are not educated in Chinese medicine, so they don't really provide good management of Chinese medicine. And since there is insufficient funding, the clinics have to be self-financing, so there is too much emphasis on treating patients, and the practitioners have to travel between clinics to try to earn more funds, and they can't really spare enough time for teaching. And Chinese medicine practitioners have been deprived of what they deserve. They are not formal employees within the healthcare framework. There is no mechanism for promotion or career progression. So now the Chinese medicine sector views that Chinese medicine must be formally incorporated into the healthcare framework so that the public can receive adequate health care, and Western medicine practitioners are relieved. Now, the Chinese medicine clinics and the hospitals should be able to devote their full effort to Chinese medicine. Next, Mr. Chairman Hon. Good afternoon. I'd like to talk not just about Chinese Medicine Hospital, but on the formulation and consultation of policy on Chinese medicine. Now, the government says we agree that the Chinese medicine should be on a self-financing basis, but actually that is not supported or initiated by the practitioners. Now, also, there is a surplus of Chinese medicine practitioners. Now, there has been the official report that recognizes the surplus. It hasn't considered the number of graduates from the mainland, and no solution has been put forward. 3 years ago in LegCo, I spoke on the same issue. Now, this year, the passing rate has fallen sharply, and half the graduates from University of Hong Kong could not pass. Now, they took 6 years of university education. They don't know how many more sessions of exams they have to sit for before they can practice. Now, there is no one in the government sector who is familiar with Chinese medicine. There's no long-term plan. Consultation has not been effective. On the Chinese medicine hospital, there are terms such as RCT and specialist concepts. These are Western medicine concepts, and some Western, there are some comments saying that the Chinese medicine hospital should be a home for recuperation, and there should be consultancy by Western medicine practitioners. There is no formal approach to how to prevent Chinese medicine from being westernized.
So I hope that the Chinese medicine groups to be set up by the Bureau should include young and frontline Chinese medicine practitioners, and instead of just inviting experts alone, we normally don't agree necessarily with what they say. And I hope that the Food and Health Bureau can really be aware that we know all the data, and instead of spending money on organizing forums or reports, please put in more resources to carry out a pilot scheme so there can be Chinese medicine wards in public hospitals. The government's mindset should be changed. It should not consider resources in Chinese medicine as a burden, but rather an investment in the future. Next one is Ms. Law. Chairman, good afternoon. I'm Chinese medicine practitioner. I'm a frontline practitioner involved in the ICWM pilot program. The program is supposed to provide reference for future operations, and the program has been running for 3 years, and there have been problems. First is to do with its charging mode, and money actually pays for hardware and operations. And similar to the future Chinese medicine hospital, the NGOs and the patients will bear the costs. Now, patients of the $120 of basic daily fee, if they're to receive Chinese medicine, they will pay an extra $200. So each month they will need to pay an extra $6,000 to have access to Chinese medicine practitioners. But many people, because they cannot afford the money, therefore they are deprived of the chance to see the Chinese medicine doctors. So right now, the charging schemes actually should reflect to the government that if the Chinese medicine hospital is to be mainly supported by patients without adequate government resources, indeed the government needs to put in more resources to make the hospital operations viable. And I'm also worried that whether, because of limited size of the program, and which is practiced in 7 sites, and so there are only about 1,000 cases being put on board. So it's very small in terms of size, and the operational scale is limited either. And many decision-making powers now do not rest with the Chinese medicine doctors, but with the Western doctors. For example, which patients want to accept for Chinese medicine treatment, and also what we should do with the patient whose situation has deteriorated. And often, Chinese medicine doctors cannot make all the decisions. And yet, if you want to have a Chinese medicine hospital, you need to let the practitioners have bigger involvement. We don't know what your timetable is for a full-scale pilot scheme. I think you do need to quickly expand the ICWM pilot program. And the program has only targeted 3 kinds of diseases, but to prepare for a future hospital, you should open up more diseases for the pilot program. And in the future, the Chinese Medicine Hospital will be a teaching hospital for the 3 Hong Kong universities and a new alternative mode for local people. So the Chinese Medicine Hospital should have its own mode of operation. Therefore, you need to be careful with its operation and allocation of resources. Thank you. Next one, please. Good afternoon. I'm Li Wing representing frontline Chinese medicine doctors. We are very concerned that the importance of research and teaching. So the first Chinese medicine hospital must be fully funded by the government. If it's to be run by the NGO, of course that mode will allow for flexibility. But in order to have a balance in income and expenditure, and to make sure that there can be teaching and research facilities there, the Frontline Chinese Medicine Alliance would urge the government to amend the Chinese Medicine Ordinance to fit the needs of the daily operations of the Chinese Medicine Hospital. And we need to have the top person in charge of the hospital be a registered Chinese medicine practitioner. So when you are to have the pilot program expanded, you need to make sure that it is backed up by law. And also the future hospital cannot just have a Chinese Western collaborative medicine. It should have also a pure Chinese medicine treatment which does not require Western style nursing. And also we need to make it clear when the Chinese medicine will be the dominant treatment and when the Western will be the dominant one. We need to make a clear differentiation between the two in the treatment process. That's all I want to say. Thank you. Next one is Ms. Kam. Thank you, Chairman. Good afternoon. I'm representing the Open University Healthcare Division. You know, in the policy address of the policy address in 2014, Hong Kong will build the Chinese Medicine Hospital, and later on there's been mentioning of it in the other policy address. Hong Kong can make reference to the operations of the mainland Chinese medicine hospitals for its future plan. In the future hospital here in Hong Kong, we can use the Chinese Western collaborative approach, but it needs to be Chinese medicine-led. And of course, we can have collaborations and using the Western medicine there for complementary treatment. The future hospital, of course, will need a great amount of resources and manpower. All law nurses in Hong Kong have been trained according to the Western model. So how can we have professional nurses for the Chinese medicine hospital? We need to make reference to mainland hospitals where when there are Western trained nurses allocated to Chinese medicine hospitals, they will undergo training in Chinese medicine nursing so that they know more about Chinese Western collaborative approach. And the Hong Kong registered nurses should also be given a chance to study Chinese medicine. Only then can the nurses have Chinese and Western medicine knowledge. And besides, within the hospital, in order to provide the nurses with more practicum, we need to provide them with the training opportunity so that they have clinical experience. In 2014, after the news was broke that Hong Kong will have the Chinese Medicine Hospital, Open University, Nursing and Healthcare Division, knowing the future demand for manpower, in 2015, we opened a 2-year master's course for registered nurses on the basis of their Western learning. To equip them with the Chinese medicine knowledge and to give them clinical training. They will also have a chance to have practicum in mainland medicine, Chinese medicine hospital. In September this year, our first batch of master's degree graduated. We hope that in the future, they can be able to work in the first Chinese medicine hospital in Hong Kong. We'll continue to train up nursing professionals with Chinese and medicine knowledge. Thank you. Mr. Lam Wei Man, next. The Chinese Medicine Hospital to be funded by the government is welcomed by the sector on the whole. Setting up the hospital is not just good for curing main diseases and provide more in-hospital treatment for people undergoing rehabilitation. It can also provide good training opportunities for Chinese medicine students from the 3 universities. And it can also help integrate manpower in Chinese medicine. As for the mode of operation, there are 2 aspects. One is the financial operation, and the other is the operation in terms of giving medical treatment. I think the treatment should be dominated by Chinese medicine, complemented by Western medicine, because Chinese medicine is more micro in nature, whereas Western medicine have a more macro approach. And so Chinese medicine and Western medicine are under 2 different systems. At this stage, if we adopt the the model adopted on the mainland in terms of Chinese-Western collaboration, that may not fit the local context. And Chinese medicine practitioners, in dealing with patients, there can be constraints, and the expertise of Chinese medicine mainly lies with curing chronic diseases, but it's not best for treating acute diseases, and neither does it have the provision for surgeries. So if you appeal for a Chinese medicine-led operation, then for emergency cases, the patient's concern might be at risk, and the public confidence in Chinese medicine may be undermined, which would not be advantageous to the long-term development of Chinese medicine. So being Chinese medicine-led and complemented by Western medicine, that can allow the Chinese medicine system to bring in Western medicine knowledge and also to enable the hospital to cope with emergency cases. And that would be able to provide or strike a balance and providing better care to patients. In terms of the financial operation, because there are specialized equipment, the hospital, and the specific demands for the architectural design, if it is to be funded by civil groups, then the operating costs, architectural costs might be too high, and it's good for the government to support the building costs or the operation costs.
The funding of the construction should be by the government, and there should be premises for long-term health care for the elderly within the hospital. The income should contribute to the operation of the hospital, and healthcare personnel can provide consultancy service, and there would be development of treatment for the illnesses. Next, Ms. Ho Mei Yi. Now, I am the chairperson of the Academy for Chinese Medicine Healthcare in Hong Kong. Now, we conducted a questionnaire. We collected responses from 921 members of the public, and the findings show that the public are very supportive of integration of Chinese and Western medicine services. They hope that this service can be provided as quickly as possible in the community. We think there should be collaboration between Chinese and Western medicine. The Chinese medicine should be in the leading role. Nursing is very important. They provide the bridge for communications between the practitioners and the family members. They also provide a service in referrals and so on. And at the outpatient clinics, there can be preliminary assessments and then referrals, and in the convalescing session, there would be services where again these personnel can play an important role, and also in clinical services, nurses absolutely play a key role in coordination and assistance, and on research and study on research. Now also there should be an evidence-based approach where the nurses can contribute to a major extent, and also nurses can play a role in education. Now, since the nurses can play such an important role, we should try to resolve the problems that they face. Now, which side is treatment and which side is health care? Now, how to prevent unfair assignment of responsibility? Now, if we make a mistake, what will happen? Now, which organization will be responsible for certification? Will there be sufficient manpower provided? Next, I am Yip Man Pan of the DAB. Now, since the policy address announced that the Chinese Medicine Hospital would be built, we are supportive. Now, in the 2014 policy address, the CEO already said that the land would be set aside, and progress has been made this year. So the public has awaited this for a long time. Now, on the future operation of the Chinese Medicine Hospital, there is no suitable example elsewhere in the world. So we are concerned about how it would operate and its positioning. Now, on positioning, we noted that under the hospital authority, there are 42 public hospitals and related institutions. We think that the Chinese medicine hospital should be different. The underlying concept and the clinical mode should be based on Chinese medicine tradition and modern technology. And there should also be innovation. Now, can Chinese and Western medicine practitioners cooperate? And if so, how will they collaborate? Now, we think that all these practitioners should cooperate and try to provide more for the patients. Now, there are legal considerations and various other considerations. So there should be standard guidelines for Chinese and Western medicine practitioners to be fully aware of responsibilities concerned. Now, the DAB welcomes the current scheme. We think that the Chinese medicine hospital should be operated by the hospital authority and built by the government. It should provide inpatient, outpatient services and be a base for scientific research. Now, there should be Western medicine practitioners and chemists and so on to provide for the needs of patients within the Chinese medicine hospital, and they should take care. The hospital should be able to treat various illnesses, including injuries from illnesses. Oh, I will not speak. Next, Mr. Ngan. Good afternoon. I am from the Yi Hong Chinese Medicine Merchants Association. I'm also a registered Chinese medicine practitioner, and we believe that the Chinese medicine hospital should be operated by the government through the hospital authority, and there should be persons who have a deep feeling for Chinese medicine to be in charge, and it doesn't have to be self-financing. Otherwise, there would be dubious modes of operation, and there should be a narrowing of the differences between the Chinese and Western medicine practitioners. That there should be same remuneration for the same work, and it would be a platform for exchange between Chinese and Western medicine, and there should be scientific research integrating Chinese and Western medicine. I think there should be Western medicine diagnosis, and there should be treatment by the Chinese medicine approach, and there should be scientific research on that basis for major illnesses, so that a new integrated mode of treatment could emerge. Mr. Yang, on behalf of my association, I greet you. This is the new term of the government, and the government has taken active steps to implement the Chinese medicine hospital. Previously, the government said that the hospital might be operated by NGOs. Now, we think that this hospital doesn't just serve the public in offering treatment. It should also be the center for training and research. So it must be funded with government funding, like other hospitals, like other government hospitals, and so that the potential of Chinese medicine can be reached. Since the reunification after 18 years, the Chinese medicine has developed in a satisfactory way. This has been with the help of government support and the hard work of the practitioners. Now, Chinese medicine plays an important role in the healthcare of the public. Many members of the public adopt services such as acupuncture for treatment of long-term illnesses, and some illnesses involving pains and bone ailments can be effectively treated by with Chinese medicine. Now, unless there is passing on of the knowledge, some of it may be lost after the elderly practitioners pass away. Now, the progressive development of Chinese medicine could relieve the pressure on the public healthcare sector, and there should be reforms in the coming years so that the practitioners can develop their potential and the public can receive better service. Now, this is an important step forward. We thank the 12 speakers for speaking, and we now let the administration respond. We thank the representatives for airing your views on the development of the Chinese Medicine Hospital. We hear you. We hear your specific comments. Now, first on the hospital, on the 18 teaching and research centers, and on the integrated Chinese Western medicine pilot scheme. Now, first on the hospital side, now I believe people are concerned whether the positioning can allow Chinese medicine to play the lead role. Now, I'd like to tell you, it's because we know that there hasn't been a hospital or clinic which has been truly Chinese medicine-led in the past. So therefore, we need to do a lot of consultation for its implementation. Now, on how to achieve a Chinese medicine-led role in healthcare, we have been trying to fine-tune our thinking. Now, we want to exploit the traditional strengths of Chinese medicine. Of course, there needs to be Chinese Western and Western medicine collaboration in some areas. For instance, when someone is ill, at one stage it might be better if it's Western medicine led. At another stage it may be Chinese better if it's Chinese medicine led. So we are we are doing consultant studies to try to implement the Chinese medicine-led role. This is our objective. Please be assured. Now, also on the progress. Now, in early 2016, you will remember that the government invited different groups to submit expressions of interest. We received 7 of them.
And received different kinds of responses on financial arrangement. It's very clear that in terms of the construction costs, after consulting the Chinese Medicine Development Committee and the Chinese Medicine subgroup under it, and having consulted the group in 2017 January, we announced that the government have decided to fund the construction of the hospital. In terms of operation of the opinions we received, several suggested that the government may have to make special arrangements in the first 5 years or 6 years of operation. So that's the opinions we received. And there are also other submissions which support the self-financing mode after the initial few years. So through the HA, our consultant would also make reference to other places, the experience of running Chinese medicine hospitals there, and you can see that some hospitals are actually making profits. So therefore, now we are making reference to various models, considering various opinions. We do not rule out the possibility that the government could play a role in supporting the operations. But we have to see what is the best option for the long-term development of Chinese medicine and what's the most flexible model. Only then will the government make a decision. And I also like to remind you that when the time comes for the construction of the hospital, we hope to provide for relevant training as well, because there will be a teaching hospital. We hope that we carry out evidence-based research and services, and there should be more scientific research done there. And just then you were mentioning about the 18 plus Chinese medicine teaching research centers, whether their work is adequate. So maybe now ask Dr. Xie from the HA to supplement. And on the Chinese Western medicine collaboration, where there can be new types of diseases to be involved, so I'll see if we can supplement as well. Dr. Xie? First of all, for the 18 Chinese medicine clinics, in terms of the curing, teaching, and research on the basis of public response, we have taken follow-up work already. For example, as mentioned by deputation, or asked by a deputation, and in terms of salary, with the help of the Food and Health Bureau, over the past few years, we have adjusted the salaries. And in terms of the teaching, in the past, we provide training only for those who are in the first year of the Chinese medicine profession, and with discussion with the HA, we now increased it to 3 years. Besides the training, we are also offering incentives, scholarships, allowing our various centers to Beijing, Shanghai, Guangzhou, and so forth to provide training for tertiary and junior and more experienced Chinese medicine practitioners. We've also invited mainland professors to come to Hong Kong to provide clinical instruction or even teaching. So this is Chinese medicine based. And in terms of Chinese Western medicine collaboration, in terms of training, we have done follow-up work. In 2016-17, 200 plus of our colleagues have taken part in various Chinese Western medicine training courses. So we'll continue to communicate with the Bureau, hopefully to further step up the training and support as needed. And since 2008, we have kept collaborating with the 3 universities and also some other medical schools on using Chinese medicine to treat depression or insomnia. For example, one of the doctors from Hong Kong U So it is research, primarily Chinese medicine based. So we have carried out systematic review as well of the research. And the last couple of years, we have in the area of research, because there's a demand. We know there's a demand for Chinese medicine research talents. Therefore, in the 18 centers, we have launched a research training program. Hopefully, in the 18 clinics or centers, there will be a research team, who can promote further research. And so for the curing, teaching, and research, the 3 aspects, we'll continue to see what more we can do in those 3 aspects and make further improvements. Mr. Chen, just then deputations on the 18 centers and also the ICWM pilot program. They said that there's much room for improvement in those 2 areas. Let me say that those schemes are intended to provide reference for the future Chinese medicine hospital. Doesn't mean that the future hospital will follow the exact mode of the current schemes. Since this month, indeed, the stakeholders consultation will enter its 2nd phase. In this month, we will, through the consultants and the HA, on the development of the positioning of the Chinese medicine hospital, have thorough consultations with various stakeholders. And today, all the views expressed by the deputations is very important to our current consultation. We'll definitely record them. And HA staff will later on, first again, with all stakeholders on the framework of a development for the Chinese medicine hospital and also all the details mentioned, we'll have further consultations. Right now, the government has no firm plan yet. We have to wait till all the consultations are done. After the HA has submitted a report to us, we hope that by the first half of next year, we will come up with a framework for the development. And then we'll come back to this panel and brief members on it. That's about it for now. Thank you. So just I heard from deputations. Well, our next round is the members' time, but then I'd like to mention that deputations asked that they mentioned about the pilot program currently. That is, if someone in a ward wants to see Chinese medicine, the practitioner, they have to pay $200. So if they have to see for 1 month, they may have to pay up to $6,000. So if you support Chinese medicine, so why do you have to? Why are you charging the patients extra for seeing Chinese medicine practitioners? So, any response from the bureau? The $120 daily fee, isn't that supposed to include Chinese medicine as well? Well, the ICWM pilot program was launched by HA. Maybe I'll ask Dr. Xie to comment on the fee. Okay. On the pilot program itself, it's mainly intended to prepare for the future Chinese medicine hospital and for us to know in terms of operations what are the possible problems we could encounter and try to apply solutions in the future. So the service itself is not part of HA's original service, and because it's a pilot program which is joined on a voluntary basis, even though it has funding from HA, therefore its daily fee is way below what the actual costs are. So NGOs are actually involved in running the program. So in terms of this ICWM pilot program, we have gained approval from the Food and Health Bureau. That is for patients who are on a CSSA who have low income. Their fee will be waived. So this is sort of, but still it services because it's on a voluntary and pilot basis. So therefore, its fees will need to be determined by the actual expenditure and of course slightly adjusted. So will this pilot program be regularized afterwards? What will happen in the future? And also, I just heard from Mr. Chen that the program will have reference value. So maybe you need to take note that if the Chinese Medicine Hospital provides Western medicine doctors, then what will the doctors charge? Will they charge $200 or dollars extra for seeing a Western medicine doctors? So, and then they have to charge extra for Chinese medicine, then that would be a lot if that's the case. So pay $200 to see Western medicine in the future, and then if you keep coming up with the same reason because it's not saying that it's not HA service, then well, it could still be a problem. Of course, you said this is a pilot program and joined on a voluntary basis, and you have to pay for the course. I know it's a matter of principle, but in the future, and whether there will be different charges for Western Chinese medicine, you need to take note of that potential problems. Okay. So now we have 3 members with questions: Helena Wong, Shu Kao-fai, and Yu Si Wing, Regina Ip, 4. So each will have 5 minutes. Helena Wong, thank you, Chairman, and all the other guests for telling us your areas of concern. The Democratic Party supports the building of the Chinese Medicine Hospital. Just then, I think I heard a unified view from the deputations, and they said that they hope the Chinese Medicine Hospital will be made part of the public hospital system. But from what the DS said, or the PS said, it seems like the government doesn't agree with that. The government has said that the government will fund the construction of the hospital, but the operations might be left to an NGO. And during the running operating process, we is not known how much money the government will put in. So therefore, it won't be a fully publicly funded Chinese medicine hospital. So, with all the deputations, is that what you want to? You want to have a hospital that's like Queen Mary, Queen Elizabeth, all other hospitals run by the government, right? Which follow the government pay scale and establishment plans and distribution of drugs and ratio of doctors and patients and so forth, right? Of course, you can charge patients' fees like in public hospitals, but it's not like being run on a self-financing basis. We're not talking about a hospital that is to make profits or be self-financing, because it's all on the cost recovery basis, then things would be much more expensive. And that's why we need a Chinese medicine hospital. We don't want one to make money, nor one to be self-financing, because if it's self-financing, then the outcome is things will be very expensive. So I hope that the government would not discriminate against Chinese medicine practitioners, making it self-financing. Because if that's the case, it would not be able to grow healthily. It will be struggling, and the fees will be very high. So I'd like to ask the PS, can you explain to us why is it that Western doctors, Western hospital will be publicly funded, but not for the Chinese medicine hospital? We're talking about just one Chinese medicine hospital, not 18 of them. So why can't we have public funding?
Permanent Secretary, first to clarify, the government doesn't discriminate against Chinese medicine. We are trying to take forward the development of Chinese medicine. It's because of that, even though we never had a Chinese medicine-led hospital, we are going to embark on that. The government initially hoped that the operator would build and operate on a self-financing mode. We want there to be the maximum flexibility. Maybe that can be achieved. Now, this is our initial proposal, and we heard the public's views, and in the 2017 policy address, now we've decided that the construction would be paid for by the government. Now, on the operation, whether the government would input the funds for that, now we are doing the consultation now. We haven't decided on fully taking on the financial liability for the operation, for the government to fully take on the finances. Now, actually, there have been cases where Chinese medicine can be operated on a self-financing basis. So now I think the PS has perhaps been a little misleading. Now, we are all agreed that the government is going to fund the building of the hospital. Now, we are not saying that the patients should pay nothing, but we should make sure that poor people will not be deterred from seeking Chinese medicine help. Will the government take on full responsibility for the financing of the Chinese medicine hospital? Of course, you can charge fees as long as they are reasonable. The government is doing consultation right now in early 2016. That's very soon. We hope to be confirm the funding of Chinese medicine hospital and the government's positions on the main areas of concern. Now, we might remind the government and the members, now, please be careful. Now, there are now no government hospitals. There are actually hospitals under the hospital authority. Now, if you're talking about government hospitals, are you saying that it would be under the health department? Now, there is legislation on hospital authority, and there's legislation on private hospitals. So there is this might give rise to various problems. So please don't just say we want a government or publicly operated hospital. So please be more specific. What is it that you actually wish? Now, if the hospital is to be run by the hospital authority, then how would be the costs be funded? Now, if the future Chinese medicine hospital would be incorporated into the public healthcare system, now that might sound simple, but what does that mean? Now, there are 42 hospitals and institutions under the hospital authorities management, but some speakers don't want Chinese medicine to be in the lead. Now, so should there be a separate governance structure for Chinese medicine hospital so that it's independent of the hospital authority? Now, so I think speakers can be more specific. Now, governance is one aspect, financing is another aspect, and that's the aspect I believe people are concerned about. Mr. Xiu Ka-fai, first, I'd like to thank the current term of the SAR government for going ahead with the Chinese medicine hospital. I think that's good for the public, and we thank the officials and the deputations for coming. And I've heard most of the speakers. Now, their feeling is that the SAR government hasn't quite provided enough support for Chinese medicine. Now, I think we should continue to work on that. And on the Chinese medicine hospital, how it's going to operate. Now, most speakers felt that the government should use its resources to take care of that. Now, if you might say you let the NGOs to do it on a self-financing basis, and PS said that it might be on the basis of making money. Now, this is a private market. Now, if we are saying that the government is going to provide assistance to the public so that they can choose Chinese medicine. Now, of course, we all recognize the merits of Chinese medicine. I patronize Chinese medicine practitioners myself. I believe there is strong demand. Now, if you turn the hospital into a privately operated hospital and you say it's going to be profit-seeking, then the public would be footing the bill. So the government should provide financial support. We're now talking about just one Chinese medicine hospital. Now, if in the future there are private bodies which want to make money from that and who want to provide better service, now they can take that business risk. Now, for the public, we want to provide them with an affordable choice. Now, for the general HA hospitals, the public just pay 120, whereas for Chinese medicine they have to pay 200 more. That doesn't seem quite reasonable. We don't want their choice to be based on financial considerations. So I believe most speakers share my views. Now, on self-financing mode, I hope that the administration will take note. Now, I believe the government doesn't want to make a profit when it introduces this initiative. It wants to give the public more choice. Next, Mr. Yu Si-weng, if the administration has no reply on this. Now, of course, we support the establishment of the Chinese Medicine Hospital. Now, its positioning is to train manpower, to engage in scientific research, and to review the possibility of cooperation between Chinese and Western medicine. Now, the PS says it's considering whether it's to be self-financing or not. Now, if you just want to offer treatment, then you shouldn't also be saying that you provide manpower training and scientific research unless you are prepared to inject the funding. Now, otherwise, if your positioning is not clear, now there will be concerns on the manpower resources and the equipment provided and so on. So I hope by early next year there should be clearer positioning on the hospital and on the government's role. Now, there are now legislation on Chinese and Western medicine, but not so much for Chinese as for Western medicine. Now, so the Chinese medicine practitioners are under greater pressure. Now, if there is a mortality during treatment, the Chinese medicine practitioner has to bear great responsibility. So, before the Chinese medicine hospital comes into being, there should be a line drawn. Now, if there is a problem, some mishap, then to what extent would the Chinese medicine practitioner bear the responsibility? Now, there is the issue of rights and obligations. Now, if you want to get a certificate for death or get a treatment record. Now you should establish the rights and obligations for the Chinese medicine hospital. Now, if you don't, then it won't be a hospital. It will just be a convalescent home. Now, also, will you actually achieve Chinese medicine leading role with the support of with the support of Western medicine? Now, when will you be able to provide the structure for that so that the practitioners can get a better idea and avoid future problems? The PS. Now I will speak briefly. Perhaps my colleagues can supplement. Of course, on the division of labor, the rights and obligations of Chinese and Western medicine, of course, that may involve a change of legislation, amendment of legislation. Now, do we have to resolve every such issue before the establishment of the Chinese medicine hospital? Do we have to change the legislation to allow for all this before we implement the hospital? I think this can be dealt with at the same time. There can be some compromise so that the hospital can be operating while we try to refine the legislation. Of course, we have to be clear on the scheme, but do we have to amend all the legislation before we implement the hospital program? I don't think so. Now, the second stage of consultation is going ahead, and we are consulting the stakeholders, say on all the arrangements in the future hospital, and we do it by a questionnaire. And once we get the views in the first half of next year, based on the findings, we will try to come up with the developmental framework of the Chinese medicine hospital, including the Chinese medicine-led mode. So please make clear what is the scope of rights and obligations for Chinese and Western medicine respectively. Regina Yip. Now look at the constitution of the PRC. Now, Article 21 of the Constitution says that there is to be development of traditional Chinese medicine, and Article 138 of the Basic Law says that the SAR government will be responsible for policies for both Chinese and Western medicine. So the two are equally important. Now, based on that principle, now the Western medicine is supported by the resources of the hospital authority, and it's funded by the taxpayer. But you just say for Chinese medicine, it has to be self-financing and run by NGO. Now, so that's not equal treatment. Now, you train graduates from the schools of Chinese medicine, but you don't have the support measure, so you would waste the manpower. Now, you have to pay for the recurrent expenses, so that there should be adequate staff, and the public should get subvented services. So it's the Chinese medicine practitioners get lower pay under the Jockey Club supported scheme, and they get less subsidies.
So we have to look at the details. You need to make Chinese medicine on a par with Western medicine. That should be our goal and principle. Do you agree? Or do the Chinese medicine doctors agree? It's a matter of principle. P.S. Or in principle, we definitely agree that the government must do further in strengthening the training of Chinese medicine, and also before launching the Chinese medicine hospital, we need to prepare with the support measures, not just the provision of Chinese medicine practitioners, but also support staff with knowledge in Chinese medicine. As for the pay scale, we have considered, for example, in the 18 Chinese medicine teaching research centers, the practitioners and their staff, the salary scales. We have actually, we will make adjustments in December, even though they are staff of NGO and not government staff. I'd like to say that we are determined to really provide good support measures and strengthen training. Chairman, just then, of course, the government says that it will do further study and the future hospital will be run by an NGO, but that's hugely worrying. You can see, like the long-time neighborhood or community organizations like the neighborhood service. It has been embroiled in a scandal, with even huge financial loss. And there are also other consortiums running public services that actually are substandard. So if you have a new Chinese medicine hospital which is not subvented or funded by the government and allocated to an NGO, that would just create a mess and a waste of the land and the manpower. So I think the government really should have a serious study of the matter. Next one, Kwakaki. Chairman, I'd like to know more about this. The concept of the Chinese medicine hospital is quite rare worldwide. The only reference we can get is from the mainland. But monitoring in the mainland, I wouldn't comment on that. There could be all sorts of events happening in Chinese medicine hospitals on the mainland. I don't want to see the same happening in Hong Kong, where things just go right out of hand. And I think for Western-trained doctors, I don't think they would mind having a Chinese medicine hospital where they would not be held to account. Their training is different. If you ask a Chinese medicine practitioner to work together in the same hospital with Western doctor, I don't see, I can see, it's difficult for them to share responsibilities, because no one knows who should be held to account in the end. So in the future, the Chinese medicine hospital should be mainly operated by Chinese medicine practitioners. I don't agree having Western doctors being stationed there. Western doctors in public hospitals have too many patients to see anyway. I think those doctors would rather concentrate on what they're doing now. And my third point is I like the PS to confirm that let's don't mix Chinese medicine practitioners with Western doctors in the same hospital. And also, now in Hong Kong, every doctor needs to take out their own insurance. It's not required by law, but I believe most doctors will do that. So in the future, in the hospital, what sort of preparations does the government have? Or in terms of liability insurance, to protect patients' rights should accidents occur. There could be all sorts of disputes. And also about the resources. All the, medical budget is a big cake. Honestly, all specialty don't have enough money nor medicines, so we have to wait for a long time for surgeries to take place. So if the government allocate a part of the medical budget to develop Chinese medicine, no problem, I'm not against that. But for many people on the waiting list or waiting to be treated, what will happen to them? Will the government promise that there will be, will there be additional funding for them rather than from the same HA budget, because we need to be fair to the patients now on the waiting list. P.S. Okay, I'll try to answer the best I can. As for whether there will be no Western doctors in the future Chinese medicine hospital, I think under our current thinking, it's quite difficult not to totally not have any Western doctors stationed. Because, as I said so far, Chinese medicine practitioners cannot issue death certificates, and nor they sign the order for supersound or X-ray. So if there's no one in the hospital that can make such orders, then there will be difficulties unless before the hospital begins operation, we can ensure that all the relevant ordinances are amended in time. But I believe that to amend the law to allow Chinese medicine practitioners to do all the basic tasks, it will still be controversial and will be time-consuming. Of course, we need to consult the public on these matters, but what we have in mind right now is that we are thinking that of course, the future hospital will be led by Chinese medicine practitioners, but there may be a need for a Western medicine section. But, sorry, let her answer, please. Please let her finish. Well, traditionally, Chinese medicine practitioners will not order ultrasound or X-ray. Well, please let her finish. As for taking out insurance or new budget, well, for new money, I believe if the government is to put in resources into the new item of Chinese medicine hospital, that would be an additional budget. It would not actually take away part of HA resources. Okay. For the rights and obligations of Chinese medicine practitioners in the hospital and the liability insurance, I think under the current constitution, they will be covered. And our association thinks that the future hospital should take out appropriate professional insurance for its staff. And indeed, under the Chinese Western Medicine Collaboration Approach, HA has also taken out relevant professional insurance for its staff. Mr. Chen, next one, Chen Puyin. Thank you, Chairman. Following up on Dr. Kwok's question, for Chinese Medicine Hospital and its liabilities, I agree with Dr. Kwok that, as many Western doctors told me, they really don't mind the future Chinese Medicine Hospital being Chinese medicine-led. On the contrary, we do mind having the Chinese medicine, Western medicine collaboration approach, one in which the Western medicine will be held liable should anything happen, any incident occur, like under the current system. Under the current system, if there are patients with issues arising from Chinese medicine, we can't deal with we can't deal with it either, and yet the Western doctors are the ones who will be complained against and even have the license revoked. But I agree with what the PS said. There are administrative arrangements that need to be dealt with, so we'll see how the government can sort it out. It's very important because Chinese people, say Hong Kong people, very much want to have Chinese medicine services, but not Chinese Western medicine collaboration or Western medicine led by Chinese medicine. So and for you don't want to see high-risk surgeries are being done by Western doctors and who will also be held to account. But that would be unfair to the Chinese medicine practitioners as well. So that's the end of the first round. We have 3 more members with questions. Helena Wong, Xiu Kafei, and each will have 5 minutes. Helena Wong first. I heard from the government just then that they will have consultants doing the report. By the end of the year, they would have finished, and the report will be out next year. So I'd like to ask, just then PS said that they will come back to LegCo to consult us. I'm sure you will consult the public and the LegCo. There'll be a chance for you to do that before you invite the tenders. In today's paper, firstly, I can't see from the paper any summary from the consultancy study, and for the pilot program, it has been running for some years, and yet we haven't seen the review report, so we have no details, no any content available. So I hope that the government, in due course, please disclose to us ASAP the pilot scheme under which Chinese medicine plays a leading role and supported by Western medicine. What's the outcome of the review? And also, let's be given the details of the consultant's report. Once we know, have an idea of the government's framework for the future management and operation, the funding arrangement, once you have got a blueprint, then the consultation and discussion will be more focused. Now we're just talking about the overall directions, and yet we don't know how you're going to operate in the future. Even though the government said that it will be led by Chinese medicine, but there could be operational issues. How are we going to deal with those issues? So the government, if you have such details, please give them to the public, the sector, and LegCo ASAP. Before you make a final decision, we have a chance to talk about them. Yet we don't have the details now, so we don't really know how you're going to go about doing it. Can the government tell us when you think you will have all the reports or review report on the pilot program available for us? Okay, PS, indeed, I think Dr. Wong is right. From the conceptual stage to implementation, there are many really areas that need to be thoroughly discussed. Just then, the 2 Western doctor members, they mentioned about the differentiation of rights and obligation. You all know that we need to have a clear differentiation of, duties and powers, and so that requires discussions by the Chinese medicine practitioners and Western doctors. They may have different views, and there's a lot of work to be done in that regard. We will come back to LegCo, but how we can supplement? Yes, in terms of the time frame, I hope that in the first half of next year, on the positioning of the development of Chinese medicine and the operational mode, we'll come back to this panel to report to members and consult members on that.
As for the CWM pilot scheme, now in June 2015, we did make a report to the panel. Our plan is that right now we are conducting a review on the pilot scheme. We expect by the 3rd quarter of next year, we will come back to the panel to report the review findings. Now, in June 2015, we already provided material to the panel. Chairman, now I have a follow-up question. Now, we received the document from the Association of Chinese Medicine Practitioners on the fact that they haven't been invited and for today's meeting. Now, you will you should also try to get the opinions and views of the Chinese medicine providers, practitioners. Now, you should also come up with details on how to ensure the safety and tracking of Chinese medicine in order to ensure that Chinese medicine is safe. Now in our public hearing, we will not take the initiative to invite deputations. We will tell members that we have public hearing, and we will put the information on our website. Now we welcome those who come. We do not have the power to take the initiative to invite groups. We do not issue such invitations. We welcome anyone who is interested after seeing our notice. Mr. Shiu Ka-fai, I'd like to follow up on the earlier question. Now, I already said that this hospital shouldn't be on a self-financing basis. Also, in the document, it says that it will provide input to education and research. Now, if it's to be self-financing, is there any stipulation on how much of the funds should be spent on those areas? Now, on teaching and research, now this will be covered in our second stage public engagement. Now, whether it's education in universities or outside, we will consider both. Now, on resources, we will listen to the stakeholders' views first. Now you will be operating on a packet system. Now you will ask to get a report on what sums is spent on teaching and how much is spent on treatment, how much on research. Now, I think Mr. Shiu is saying that you may not be able to tell us the actual percentages right now, but perhaps you can stipulate that you have these requirements regarding both treatment and teaching and research. Certainly, Mr. Chairman, all three areas will be part of the functions of the Chinese Medicine Hospital. Now, if this hospital is to be self-financing, it will levy fees from the patients. On teaching, now that's an investment. Now, if you want the hospital to be self-financing, now if you don't regulate it, how it operates, then it will spend less on teaching and research because it gets its income from service to the patient. So it will put too much reliance or stress on the first function, that of treating patients. So self-financing isn't really workable, because for teaching and research you need to invest a lot. So if you want to develop those two functions, the government must be involved. Whether it's an NGO or a company, they have to provide accounts. Now, if they are going to do a good job on teaching and research, the patients may have to pay very high fees. So please consider that carefully. Any further response? We thank Mr. Shields for his views. Now, the government thinks that treatment, teaching, and research are different in concept. Now, treating patients is different. The other two are to the government's responsibility to a greater extent. Regina Yip, the administration says that there will be new resources. The hospital authorities' resources will not be affected. Now, even though the two doctors are not present, now this is part of the policy for basic healthcare service. Now, the Western medicine practitioners, Western doctors, tell us that when they catch a cold, they also patronize Chinese medicine practitioners. Now we are told that better basic healthcare and preventive healthcare will relieve the workload on the Western medicine practices. Now, we are told that some specialist work can actually be done at the outpatient clinics by frontline doctors. So if some work is done by the Chinese medicine practitioners, that will reduce the workload on Western doctors. Now, the civil service and the discipline services want very much to have Chinese medicine incorporated in the healthcare services they receive. Now, the employment contracts for civil servants say that they will be provided with the best healthcare service available. So please consider Mrs. Yip's suggestion. Any response? The government agrees that when it promotes basic healthcare service, the Chinese medicine practitioners can play a significant role. So when the CE says that there should be better basic healthcare service, now the healthcare centers should try to provide Chinese medicine service as well. Now, the Chinese medicine hospital may not be so large as to have a huge impact, but we don't disagree that we need to let Chinese medicine play an important role in preventive care. Now, the administration is inclined to have a hospital where there is where the leading role is by Chinese medicine, and there will be subsidy at least in the early stage. Now, as for the teaching and research centers, Dr. Xie said that there has been research and teaching done. Now we have a few minutes left. Any deputations, representatives wish to make some comments? please show your hands. If you wish to speak, please raise your hands. Otherwise, your mic will not be turned on. 3, okay, will speak. Mr. Chen first, and then Mr. Lee. Now, we heard from the officials. Now, the government shouldn't just say some hospitals can make money, so it's going to work. Now, actually, we did some studies, and actually, we are told by our colleagues that they get very poor training. Now, the teaching standard is not high. Now, the Hong Kong sanatorium and so on, you can't compare with those. Then I agree that the capability of Chinese medicine is inadequate right now. If there is such a concern, the government should inject more resources. The government spends $60 billion on Western medicine a year, but there is none on Chinese medicine. So if the government injects more resources, then we can give a better account. I'm disappointed in the officials' response. On the self-financing issue, I don't understand why in the construction of Western medicine hospitals, there is no need to do much consultation at all. And now you need to do consultation, and you say it's very difficult for government to put up the funds. The government should have a long-term blueprint for the development of Chinese medicine. The government should take the lead rather than take a piecemeal approach. Now, on the establishment of the Chinese Medicine Hospital, the 18 teaching and health and research centers are a lesson in themselves. I have been dissatisfied with the performance of these centers in which I have been involved. Now, a member said that the expense on teaching is an investment. Now, I'd like to supply a bit more information. Half a month ago, the Chinese university was able to invite those centers which cooperated with it to take part in a conference, and the 18 centers are now responsible for training for the 3 schools of Chinese medicine. Now, I was there. Now, all the representatives felt that the objective was not achieved because the practitioners need to try to meet the financial needs and practice accordingly. So they don't have time for teaching and research. So there's not enough incentive for teaching and research. So the grounds have been reiterated. I understand that there will be phase 2 consultation. So we hope that you consult the stakeholders adequately. Now, on this special hearing, now we are talking about the mode of operation of the Chinese Medicine Hospital. I think there will be also government consideration on Chinese medicine and other related issues. Now, the deputations have aired their concerns. I hope when you come next time, there will be better news. Thank you.